Those are humerus, okay. So what is the medial side and which one's the lateral side of the humerus?
Medial. Oh no, medial is this.
Medial is where it attaches, right?
Yeah.
So is this right or left arm?
That's
Left.
I'm sorry, say it. You
The
said
Right.
right. Why is it the right arm? How can you tell it's the right arm?
If it could go that way.
the
Right. So hand me that scapula, and I'll show you. Okay.
goes on.
This is what I always see how.
Oh,
Okay. So you always look to see where it goes in. The medial side is, and the medial side is which arm it is. I mean, if it was like this, that's not the right arm. And that's also the posterior view. How you can tell the posterior view or anterior. So when we have our arm this way, this is an anterior view, right? So this is an anterior view. What is distinguishing about the anterior view, excuse me, is this divot, which is a fossa, is not as big as the back side. Why do you think the back side is so big? Because we have our
elbow.
elbow, okay? So it articulates with another bone to make our elbow. We have a nerve that runs down here. It's called the ulnar nerve. Do you know why it hurts so much when you hit your elbow? Because there's no padding. So when you hit that nerve, and you get that tingling feeling that goes all the way up to your head, that's because you just struck the ulnar nerve. And it hurts.
It's painful, yeah.
So that means runs me into the lower part of the arm. Here we go. So we just talked about the ulnar nerve. So what do we think this bone is?
Sorry.
That's the ulnar. What is the way we can remember this bone as being an ulnar bone?
The curve at the
It
tip.
looks like a U, right?
Yeah.
Okay.
Ulnar, yeah.
Let me show you how it articulates.
Oh,
That's what makes up our elbow.
fancy.
See how it's interesting how it all works together?
Actually, the elbow is
In the back.
in the back left.
See?
Mm.
Oh.
Okay. So some distinguishing features about the ulnar bone.
The U.
Okay, how it articulates is that U shape or cup shaped, C shape. Okay, there's a groove right here. Okay, what do you think works in that groove? Another bone. What's distinguishing about this bone, and what do we think it's called? The radius. Look at the top of that head. See how it's got that? You know what that allows us to do? So rotate our arm. So what do you think fits on this notch? Or right there in the notch area? The radial bone.
Fancy.
See how it fits
And
together?
the radius is on the outside, right?
So if
lateral.
we have our arm in the position of a cadaver, RT, so it goes to the thumb, PU. So this is our ulnar bone, this is our radius. So, but always make sure you put your arm in cadaver position.
Right.
Because some people go, well, no,
No.
wait a minute, that's got to be the left arm. No,
It's
it's
like
the right
this,
arm.
right?
Yeah, you always have to be in
So
cadaver
this is
position.
radius and on the inside.
So what's another way we could tell whether it's right or left if we just had these two? We didn't have the humerus to look at, but we had
The
these
U's
two.
faced up.
Right. So you can see,
Look at the skull.
we know that the radius goes to our thumb and the ulnar goes to our pinky. So that's the right arm. So if you didn't have a humerus to identify
Yeah, because
with,
I asked her, are you going to have other bones so that we can know which bone it is? And she said no.
no,
She's like, no, you should
No.
be able to see the bone and know exactly where it is and where it comes from.
exactly. And that's hard. So that's why I always tell people, these bones got to be your best friend. If I'm not around and you guys have time to come in here and take the bones out, make yourself familiar with them. Make them your best friends, okay? So it articulates like so, okay? So this is the radial notch where the radius rotates on. This here is called a radial tuberosity. See how it protrudes out?
So it touches.
So that's, what do you think goes on at the radial tuberosity? A point of attachment, right, for a muscle, right? So as you can see, when we have these two bones articulated, that's our wrist. So if you put your hand out this
Oh,
way,
right. That's that bump
and you
that's on the
feel it,
side.
you can feel protrusions on either side,
Mhm.
right? Before we get to our carpals, okay? Those two protrusions on either side, one on this side, one on this side, are called styloid process. It's It's a pointy little process, just like the one in the skull look like fangs. These are pointy as well. Okay,
So then the
Can I
other
see
one is
this
that,
again?
this one?
that's the ulnar, and this is the radius.
Which one's bigger?
Ulna.
The one's longer, right?
It's longer.
They're supposed to
Well, they're about the same,
be- But you can
but
get
at this
these
end
big,
it's bigger,
and
and then at this end, at the wrist end of the radius is bigger.
then the distinction is it has that little cup shape, right? The ulna.
The U.
Right, it's got that
Yeah.
C shape or U shape.
So then it'd be-
So if it was setting like this,
Just-
no, I'm make this hard.
Now you can just kind of look
How
under.
could you tell? You have to kind of just look at it, right, and visualize it.
Radius was with your thumb.
Also, the radius you're gonna recognize right off the butt because of the round head. I mean, that makes it
Flat,
so
and
much
it has-
easier.
So if we look at the radius, you said that the radius is where the thumb's at?
It's PU, so the pinky, ulna, RT.
Radius
Yeah.
and.
So just think of PU, RT. Silly bit. Okay, so I'm gonna let you guys look at these. Do you need to take a picture of the humorous? Gloria?
Okay, that's the ulna.
All right, so here's the radius. Okay, so,
And then the humerus. Ulna.
so what's the first thing you're gonna look for to tell whether humerus is right or left?
If it's medial or lateral.
If it's medial or lateral. If it's medial, how do you tell if it's medial? What side of the head facing? Medial, right? So you look at the head, okay? If the head is pointing out this way and you're going, well, wait a second, it has to go this way or this way to be right or left, and it's pointing direction. Flip it around in your mind to know that it's right or left, okay? All right, so that's that one. So let's move on to